Welcome everyone. Myself Dr. Praveen Kumar Pathak. I am working as a professor at the Center for the Study of Regional Development at the Jawaharlal Nehru University, New Delhi. So, in the series of lectures on geography of health, today I am going to talk with you about a very important issue which is related to understanding diverse risk, exposure and vulnerabilities with regard to understanding health status, health outcomes, health inequalities or health behaviors. So in geography of health, as we have discussed in previous lectures, we try to associate the patterning of health outcomes across space and places in our effort to understand how the health outcome varies between various regions. There are a lot of evidences which is available in India and elsewhere. So if you look at any health outcome per se, the health outcome varies substantially across different geographical units, whether it is inter-country comparison or if you look at a sub-regional level variation in the health outcomes, at the state level, district level, villages, urban wards, neighborhoods. So whatever may be the unit of analysis of health outcomes, we tend to find systematic variations. And this confirms that health varies with the geography where population lives. And so therefore, as a health geographer, one of the important tasks before health geographer is not only to understand these spatial patterning of the health outcomes, but at the same time, he or she tries to understand various mechanisms or drivers or factors which can help to explain spatial variability in the health outcomes. So in order to understand why does health outcome varies between population of different areas, that is different countries or regions, we have conceptualized and we have used various frameworks to understand what factors drive outcomes or health behaviors in different regions. So there are different set of factors which popularly in theoretical literature is referred to as individual level factors or social determinants of health, which is by and large individual level factors including the demographic composition of population of a given country or their socioeconomic circumstances or various cultural and social practices which individuals practice at their own level, which has direct bearing upon the health outcome of the population. And the second important characteristics is the macro environment where population or society lives and thrives. So these two important elements or frameworks have been discussed in detail, which allows us to explain health inequalities within countries and between countries. Let's take one very basic and important example of health outcome at the global level, that is life expectancy at birth. Now if you look at human history, the life expectancy of human population at the time of birth on an average was relatively limited before 19th century. And if you look at some of the data which is available, around 18th century, the global life expectancy was barely around 40 years at the time of birth, whether it's global north or global south. And part of this reason was that globally there were a lot of health vulnerabilities that people were facing. There were issues of the various infectious diseases that people were suffering from. And most importantly, infant and child mortality in earlier population was very high. So, by around at the age of 5, more than 60 to 70% population were not able to celebrate their 5th birthday. So, due to such a high infant and child mortality, we had very relatively lower life expectancy at the global level. In the next 150 years, by 1950, the global life expectancy improved to almost 55 to 60 years. And this was happened thanks to number of changes which happened in the world, and most importantly was improvement in the material circumstances of society. So if you remember, this was the time when there were industrial revolution which occurred in the European context, which led to improvement in the average standard of living of the population. It also meant that you had relatively better housing condition, you had access to good water and sanitation facilities, and there was also improvement in basic hygiene along with medical technology. All these important changes in the individual lives and also at at the environmental level together helped to prevent innumerable deaths and led to improvement in the average life expectancy of the population. But important point that we can note here is that when this achievement of life expectancy was occurring, the improvement was not uniform across the globe, and largely the achievement was far more greater in European and North American countries as compared to the Asian and African countries. And these differences further accentuated by the year 2000, where the global life expectancy touched around 70 years on an average at the time of birth. And then we observe there are a lot of differences between global north and global south. And in an effort by health geographers to explain these regional differences, we, as I was mentioning just few minutes before, we try to use different frameworks which can help to explain the inequality in the achievement of health. So let's take at the most recent data from our world data of the year 2021. This data clearly indicates there is a huge global inequality in the health outcomes at the global level. For example, if you look at life expectancy at birth in Nigeria, it is almost 3 times lower than what is there in Japan, almost 85 years of life expectancy at birth in Japan as compared to Nigeria, and which raise a very important question: why this may be the case? Why on an average at the time of birth an average Japanese can expect to live for 85 years, on an average an average Nigerian is expected to live only about 50 odd years. So in order to explain, there are a lot of variations which exist. This could be possibly because of the differences in the demographic composition or the age structure of population. It could also be related to the socioeconomic and environmental circumstances between both countries. Further, it could also be the social stratification that exists in these two different societies, and ultimately access to healthcare services. So all these important factors which work at individual level, community level, state level and national level together helps to drive the health outcome in different societies. Now here I would like to stop for a second to discuss few important points. For example, what do we mean by risk? So risk is nothing but exposure to various circumstances. So for example, risk is cumulative in life. Everybody is exposed to risk, but some people have lower risk as compared to other people. Then you have vulnerabilities. Now vulnerabilities could be because of age, it could be because of your demographic situation, age, sex. It could also be related to your socioeconomic position or the government structure, social stratification. So all of these drive the vulnerability. So for example, when you have any health emergency or if there is any disaster in the society, particularly those who are vulnerable section of society like children or elderly, they are taken care of at first, and then the other section of societies are addressed. So in this way there are vulnerabilities, and in the event of any untoward situation or exigencies or emergency, like we recently had this COVID-19 pandemic, and a number of countries were trying to not only reduce the risk, at the same time how to mitigate this risk. So a lot of vulnerability analysis was done, and the idea was to identify different parameters of this vulnerability. People used, geographers used indices such as demographic vulnerability, socioeconomic vulnerability, health vulnerability, because even if you look at the burden of morbidities in the population, it varies by age and sex distribution and also by social class of the population. So these are some of the parameters through which we can understand the vulnerabilities which drive the risk of falling to any particular infection or suffering from any given ill health condition or a different health damaging behaviors. So there are two important frameworks in theory which people have used to explain health inequality. The first one is the environmental justice framework, And this framework is based on the principle that all people and communities are entitled to equal protection from environmental hazards, and to a good quality of environmental scenario. But what is happening is we see that exposure is not the same for everybody in a given area. So for example, people who are living in the slum areas, or people who are living in locations which are close to industrial clusters, so those kinds of population have greater degree of exposure to environmental contamination, either through soil or land, or through water bodies, or poor quality of air. So they are disproportionately exposed to these hazards, which might have toll on their health outcomes. So a lot of studies in public health and health geography have analyzed association between exposure to environmental hazards and how that is linked to health outcomes. Here I would like to remind a very classic study which was done by John Snow in London around 1854. So what he was doing, basically he was trying to map the addresses of people who were dying due to cholera deaths in London. And while he was mapping these geocodes or these addresses on the map of London city, he found out very interesting observation that there was a clear-cut patterning of deaths of the resident of London, and this patterning was relatively closer to public water supply systems. And so thus he could draw a clear correlation that areas which were clusters of population from economically, socioeconomically weaker section of society, along with they were using public taps water which was contaminated, and those were the localities where disproportionately higher number of deaths were reported. So who are employing these environmental justice framework, they work on basically bring out evidences to suggest that areas where you have relatively higher environmental deprivation or hazards, which in basic simple words basically means poor quality of air, you have contaminated water supply sources, or maybe their exposure to noise, so any kind of environmental hazard. So people who are living closer to such circumstances, they are at greater risk of falling prey to various health issues and health problems. Moving forward, this environmental justice framework actually works at a continuum. So basically the context is this, that environmental exposure is not uniform. There are certain positive externalities and there could also be certain negative externalities. If you think about positive externalities, which means that to what an extent the population in a given area has access to open and green spaces. So basically it means that people have access to parks, open spaces where they can go for morning walk, where they can go for physical activities. So location or population who have these accesses, they are on an average likely to have better health outcomes than other areas where probably access to park, open spaces, green spaces, etc. are not available. Or also areas where people are exposed to for greater number of hours in a day to vehicular traffic transmission or to industrial waste, or to many times there are different localities. For example, if I can talk about Delhi, where you have garbage dumping sites, or maybe you have water treatment plants. So all of these facilities actually release a lot of harmful environmental waste, which again contribute to poor health outcomes among population who reside closer to such facilities. So in this way, the idea is geographers and social scientists who are working using these frameworks, they want to emphasize for scientific community and as well as for people who are in policy to ensure that how we provide congenial and safer environmental atmosphere to population at large, so that their health outcomes may improve over time. And so therefore, as a geographer, we use these frameworks to understand what is the pattern of environmental disadvantage in the population, how does it varies at different level of aggregation. If you are working at, say for example, all India level, you can compare how different states or union territories are performing as far as environmental disadvantages is concerned, and then we can correlate various health outcomes. For example, people look at infant and child mortality risk vis-a-vis environmental degradation. People also look at adult health outcomes or elderly health outcomes. So varieties of outcomes may be looked at, and these days because of change in the demographic composition of population, we are seeing that there is a drastic change in the pattern of diseases, which I am sure you are aware, the epidemiological transition. And so population is, on the one hand, they are suffering from infectious and communicable diseases. At the same time, they are also suffering from lifestyle diseases. And when you have these environmental disadvantage which are located in particular areas, then exposure to these chronic diseases, lifestyle diseases, they further compound. So you see that with global south in Asia, whether it's India or it's China or our South Asian neighborhood, majority of these region are suffering from poor qualities of air. So exposure to longer time for this poor CO2, carbon dioxide or sulfur dioxide, or all greenhouse gases has taken a huge toll on the population, health also, and also economy. And so therefore it's a very high time that researchers and students who are working in this area need to come out with larger evidences, so that it can help policymaker to make reasonable policies that can take action in timely manner. I would also take a minute here to emphasize the fact that we are living today in a very unprecedented time, which is also referred to as Anthropocene. It is a new term used by scientists across the world, and they want to focus on the scale of human activities, where we have actually transgressed into planetary boundaries. So if you look at greater part of human history, for almost 70 to 80% of human species, we were largely based directly on nature, and initially from Homo sapiens stage to being hunter and gatherer, moving to agriculture, permanent settlement, industrialization, and now in the last 300 to 400 years, the pace at which we have exploited our natural resources, it has been highly unsustainable. And if we continue to go on the same path, then the negative environmental externalities will have tremendous impact. And if you look at different reports of International Panel on Climate Change and many other scientific documents, clearly shows that the unsustainable level of consumption, whether it is energy, whether it is food or water, or what kind of food we are eating, all this has direct bearing on the environmental quality today. And so therefore it is a very high time for us as a geographer and a health geographer to highlight that we are living in a world of sustainable development, and it is very important for people who are working today on sustainability related issues that we focus on that whatever is available today, we have to try our best not only to meet the need of present day society, but also make sure that our coming generation also will have something to live by and live a good quality of life. So this is our collective responsibility. Now you see that what proportion of water at the global level is directly amenable for human consumption. That proportion is less than 1%. And if you look at the load on this water resource is increasing every day. So the point is, how can we use whatever water is available to us in a manner that every drop is used efficiently, and in a manner that you can maximize the utility and minimize the wastage. So why I am talking about these things? Because I am trying to relate this to the environmental justice framework, where it is not only the responsibility of our policymakers and our government structure, but any program will only succeed if there is response from the local community and the civil society, and that is the key point from sustainability framework, where each and every stakeholder has to come on board if we want to address any issue in a time bound manner. There are a number of evidences in the recent past which have tried to show us how these negative environmental externalities has led to tremendous loss to human life. And the recent data from the Lancet Global Burden of Disease 2019 clearly shows that among various environmental risk factors, air pollution contributes to disproportionately higher number of loss to human life, and also loss to productive years in disability or mobility due to air pollution. So it's very important for us as a society to take up various steps to mitigate the risk which is presented by air pollution. Now I would like to just throw before you a very important data, which is share of deaths which may be attributed to air pollution. The year is 2021. Now if you look at this map, it clearly documents a very clear fact. The areas which are marked by the dark brown color are areas which bears disproportionately higher number of deaths due to air pollution. And which are these countries? Mostly Asian, South Asian countries and Sub-Saharan African countries. Dear friends, also note that these are also places which are highly densely populated clusters in the world. So the point I want to put across is this, that because the higher number of humanity happens to live in these areas, and these areas also happen to be places where a lot of economic activities are happening, and that is also contributing to a lot of environmental disadvantages scenario. So the point is that we have to work on mitigating these air pollution issues, whether at the household level or at whether vehicular traffic, industrial issues, agriculture. There are varieties of channels through which contribute to the quality of environment, and thus it is responsibility. So the issue of air quality is not about issue of a particular community or neighborhood or a state. It is an issue which is global concern. So if India is working, India needs to work with all its neighbors, be it China, be it Nepal, be it Pakistan, be it Bangladesh. Everybody is contributing, and so our effort can only be a fruit if we work as a team, global partnership. If you look at SDG I think 16 or 17 talks about global partnership and peaceful institutions. If they deliver, we can reduce these unfortunate and preventable deaths which are happening globally. Now if you look at various factors which contributes to global disease burden, the data clearly shows that again, air pollution, water pollution, these contributes disproportionately to various, burden of diseases at the global level, among others. So there is a need for highlighting these important facts, not only among academia but also among policy level, so that action happens and it helps to prevent a lot of deaths which are unfortunately happening across the world. Another important framework is the social determinant of health framework, which is proposed by the Commission on Social Determinant of Health by the World Health Organization. Now, ideally, as a health geographers, one would like to integrate the environmental justice framework along with the social determinant of health framework. But by and large in academic research, we find that people either used to use one of them, So either they use social determinants of health framework or they use environmental justice framework. Ideally, if we have data and if we integrate these two frameworks, we may be able to explain the health outcomes or health inequalities between countries and between population in a more comprehensive manner. So let us take a few minutes to understand what does WHO's Commission on Social Determinants of Health framework actually refers to. So basically it operates at 2 or 3 important levels. The first and foremost important level is the socio-economic and political context of a given area, region or a geographical unit. So how does it matter? What happens is, let's take case of India. Now India is a federal country where health happens to be a health subject. Because the demographic, socio-economic and health situation of each state is very different from other states. Let's take a case example of Uttar Pradesh and Kerala, which are two diverse states located in very different. So Uttar Pradesh happens to be in the northern part of India, Kerala is the southern part of India. On an average, the age composition of Uttar Pradesh is fairly young as compared to Kerala, which has a mature age composition. And if you compare these two different states, has a very different health issues. Now, as a state, if we have a health policy and we are concerned about addressing the issues of population health, we should have policies and integrated policies on health, education, women issues, reproductive health, elderly health care. So if we are focusing on all these important issues, also connecting this with access to water, sanitation, better road connectivity, so all this can help to improve the health outcome of population at the state level. So it depends. As I said, if the life expectancy today in Japan is 85 years, whereas in many other parts of the world is around 50 years. So this is just not by accident. It is also because of the various policies that these different countries are implementing. Likewise, in a country's context, if you compare the health achievement in the southern part of India with the northern part of India, so many of the southern states are doing relatively better off than northern states, and there are various reasons. Part of the reasons is, of course, to what an extent various state governments are actually investing resources which helps to improve the health of the population. So as we know that health is a multi-dimensional subject, and hence if we have a we have the resources in different important avenues, education, health, gender, infrastructure, all together helps to improve the health outcome. So the first important element of the social determinants of health is the context, social context and the political context. So basically the idea is the governance structure of a given area. So that has a very important bearing on improving the health of any population in a given area. The second important element is the structural determinants of health inequalities. What does it mean? It simply means that every society in the world, whether it's in global south, global north, in India or elsewhere, no society is equal. There are various axes of stratification. There are stratification based on class basis. Some group of people are more advantageous in terms of their socioeconomic situation as compared to other people who may be socioeconomically weaker. There could be other groups like rural versus urban. It could be gender based stratification, male versus female. So there are various stratification that exist in societies. So because of this stratification, the different people have access to different resources. So if you happen to live in society which is highly unequal, so there are only few people who have resources to buy, if they fall ill, various high quality healthcare services to regain their health status. On the other hand, if disproportionately large section of population happens to be economically poor or have poor educational status or are living in areas which are far-flung areas or rural areas which are devoid of quality healthcare services, so this put together result into relatively disadvantageous health outcomes. Hence, if we want to work on improving the health outcome of population, it is critical to address this social inequality in the society. And so if we want to address the health issues, addressing the existing social structure of society is important, and efforts from the national government, policy makers should be to make societies more equal, more fairer than unequal. So if you look at countries, for example, Scandinavian countries or Japan, many Western countries, there are of course differences, but the magnitude of differences happens to be relatively lower as compared to many global south countries. And finally, the third important element is the intermediary determinants of health. So once you have different access to resources and how you can use or leverage these resources to improve your health outcomes, another important consideration is the consequences. So if somebody gets ill, the consequences is not the same for everyone. Like if a person who is economically well off, is well educated, is living in a metropolitan cities, he or she is likely to have enough resources to, through health insurance or through his personal resources, to visit the best quality of healthcare services, get the treatment timely, and come back to work. On the other hand, there are different sections of society like people who are economically not well off, working in unorganized sector, there is no access to health insurance, etc. So in such circumstances, what happens? A lot of families and population overnight go below the poverty line if there is any health situation in the family. So this is also very important for us as a society to understand that consequences of health is not the same for everyone. It is very disproportionate depending upon the different resources that people have in the family. And thus, if we look at these three important, so basically here I'm trying to show you the social determinants of health framework into two important elements. The first is structural determinants and how does it operates. So it basically tells you how different population groups have different social position, different power equation in the society, and accordingly they have different risk and vulnerabilities. And if somebody get affected through any health problem, he or she can access health system depending upon his or her position. Let's take an example of gender issues and Indian context. So a lot of women in the country have different health issues in their lifetime. Now what happens is that it is very difficult for women to go by themselves and access healthcare services. Often these women need somebody to accompany them to the healthcare services. So thus what happens, many times there are not people who are there to take them to the health facility. So that has a huge burden on their health in the long run. So this is one example how your position or your ability or decision making has direct bearing on your health seeking behavior. Another example could be if you look at the childbearing patterns in the country, particularly in India. So traditionally in Indian context, childbearing used to happen at the natal family, in the family of the mother. For example, till 2005, about 75 to 80% of births in the country used to happen at home by untrained medical professionals. But after 2005, Government of India brought number of important policy changes. For example, Janani Suraksha program was a very important program under the National Rural Health Mission, which really brought a game changer in the country and encouraged people through some minor incentives that if they come and deliver baby at the health facilities under trained medical professional supervision, it can really improve the survival prospect of both the newborn and the pregnant mothers. And if you look at the statistics in the last 15 to 18 years, India has made a lot of credible improvement in reducing the burden of infant and child mortality and also reducing the burden of maternal mortality. And among other factors, these policies of Janani Suraksha Yojana, now referred to as Janani Matritva Vandana Yojana, has really been a game changer and helped a lot of women and children to survive during the course of pregnancy and delivery. So this is some examples which clearly shows how policy and if there is a will from the side of the policy makers, a lot of things can change. And second thing is of course the intermediary determinants of health framework, which basically talks about the differences in the consequences of ill health. So depending upon the different resources that population groups have, if you have access to healthcare insurance or you have enough economic resources, if you are wise enough to understand the danger sign early, and if you go for health screening on regular basis, many times a lot of diseases can easily be prevented or controlled if you have a timely access to healthcare services. If you refer to different studies, many times maternal deaths happen because these pregnant ladies are not able to reach to health facilities on time. If they were going for routine antenatal care checkups or natal care checkups, probably if there were any danger sign, it would have been identified and they may have been treated. But so these kind of cases still exist, and so there is a lot of scope from the part of social scientists and health geographers, epidemiologists, to work on these lines and ensure that these evidences goes to policymakers for suitable actions. And so therefore I would like to conclude by saying that health risks are always there. How can we manage this health risk is very clear, and exposures are coming from both societal and environmental sides. It is important as a health geographer to integrate this and assess these risks in a collective manner so that we have enough scientific evidence for the policymaker to take due cognizance of these and take corrective measure in order to improve the health of people. Thank you so much.